Mr. President, thank you for standing up for American health care. And I just want to underline this fundamentally important issue. We need Congress to help craft the Great America Health Care Plan. And the Great Health Care Plan will work. It's a brilliantly conceived framework. And as it comes to the American people, they understand that they'll want it. And it should represent the analogous situation, similar to what you did so brilliantly last spring with the Working Families Tax Cut legislation that the President mentioned, has created the Rural Health Transformation Fund, which is why we're here today. I want to put a little bit of texture around why this is such an important issue, because the Rural Health Transformation Fund is the largest investment ever in American history in our rural communities.
Yeah.
50% increase in the amount of money that Medicaid, which Secretary Kennedy and I regulate, into our rural communities, $50 billion. You can do the math. It's $1 billion per state, and that's an important factor because it got them competing. There are 60 million rural Americans, and these folks do not have access to the same care that's available in urban and suburban America. Their life expectancy, if they're in a vulnerable situation, is 9 years shorter, because your zip code actually is your destiny. It determines how long you're going to live, and we can make a dent in this because the high rates of chronic disease and other ailments that plague our rural areas are often driven because they don't have access to care. That's going to change because of the Sentinel legislation. And again, it's similar teams, the same leadership, same president, same Congress that passed the Working Families Tax Cut legislation, which is incredibly popular around the country and will make the great health care plan successful as well. From the day the legislation was signed to create this wonderful fund, this transformational fund, the team at CMS, which is under Secretary Kennedy, began working. And they're here today. Steph Carlton, outstanding Chief of Staff, Alina Chekai, and Emily Chan. That day started working. It was July the 4th, by the way, on the specific vision for the program. How do you actually get the money out the door in 6 months? The President was insistent, did not want the money in Washington. So we began working closely to make sure that we'd use the money not as a Band-Aid, but to empower those closest to the challenges that rural patients face. And who are those people? The 50 people who know rural health care the best? The governors. They wanted the money out of Washington into the governor's hands, and that was done in a remarkable way. The governors thought big. We have one here from Nebraska who was actually the first to start working on community engagement, which is part of that legislation as well. But we have to right-size health care in rural America, and that's an important phrase. All 50 states submitted amazing ideas to transform rural health care in ways that should have been done decades ago. The CMS team awarded each team their portion of the $50 billion investment precisely with the same precision that we took Venezuela leadership, a convicted individual, and with Iran as well, the same precision on time before the end of the year, and got it out of Washington into the states. Now I want to take a step back and do a little thought experiment, Mr. President, if you want to do this. If you, and God forbid this happened, had turned your head the other way in Butler, Pennsylvania, it wouldn't have been an ear injury. Now, I've been to Butler. I'm from Pennsylvania. Butler General Hospital is a good hospital. They don't have neurosurgery there. If you have an injury to the head, you have a golden hour to get cared for. You were taken to Butler General Hospital. Because the injury, thankfully, was not as lethal as it was designed to be, it wasn't a problem. But if you'd had a head injury, you could have had your life saved. But without a neurosurgeon, and there is no neurosurgeon at Butler General Hospital, unfortunately, you wouldn't have an option because Pittsburgh is a far, far ride away. That's the closest metropolitan area where there are lots of neurosurgeons. But with this bill, this legislation rather, this funding of $50 billion, Pennsylvania got its share. And they're going to be able to build telemedicine hookups, even telerobotic surgery, that would allow an injured individual in a car accident or any other reason that is a head injury in Butler General and rural hospitals across the country to be able to access the best care our nation has to offer so rural America will not suffer. That's the promise of what this money offers to our nation. It's not just paying the bills, it's not just picking up the pieces, it's actually transforming using technology we have widely available in urban America, the way we save lives in rural America. Each state competed aggressively because for $1 billion, Mr. President, you'll fight pretty hard. And they gave us brilliant ideas that they're talking with each other about. So we're actually creating teams that now across state lines will connect because they're all Americans And they base their advances on several pillars. Secretary Kennedy can talk about MAHA because there's MAHA elements to this as well, but very precisely sustainable access. We ask states, how can we bring top care closer, like in the thought experiment I gave you for Butler General. In Pennsylvania and North Carolina, there are regional spoke models, and hub and spoke means you've got a big hospital in the city and they adopt or work closely with some rural hospitals to solve the challenges of fragmented care. And that actually works. You share administrative back office work, you group purchase your stuff, you save money, you exchange medical records. Alabama has no OBGYNs in many of their counties. So they're doing something pretty cool. They're actually having robots do ultrasounds on these pregnant moms. So we can actually get those images back to the big center. So we know if the child has a problem, and we know if that mother's at risk. We have one of the highest maternal mortality rates in the world, in the country with the best medicine in the world. It's often stated, people ask, does healthcare stink in America? Well, they don't like it. Would you leave America to get healthcare elsewhere? Nobody leaves. We have the best healthcare if you can get to it. We don't want rural America left behind anymore. As an aside, by the way, we've talked about the most favored nation drug pricing. One of the first companies and areas we used most favored nation drug pricing is fertility drugs. That's why we're going to have so many Trump babies, because we've dropped dramatically the most expensive part of the fertility space. And so America no longer will pay so many times more, in that case it was 10 times more, for the same fertility drugs that they're available for moms who want to get pregnant in Europe. I want to thank Terry, who's here as a nurse practitioner, Andrew, who's a doctor, West Virginia, New Mexico. They're representatives of the workforce in rural America. But there are only 2 of them here representative because we don't have enough people working in rural America. It's a big challenge. So Delaware is creating its own medical school, their first ever medical school in a rural part of the state. So that can get more local talent that will stay local in those parts of Delaware. Michigan is launching the high school to healthcare pipeline grant program. They want to take kids out of high school in Michigan, local rural communities, and get them into the system, get them trained as nurses, because they'll stay home because they're from those communities, and they'll save lives for decades there. These are the types of programs that can get our rural communities and economies up to high gear and keep it that way long after this 5-year funding is done. And finally, tech innovation. Rural communities would benefit the most from high-tech advances, like we just discussed, possibly if there was a head trauma case. Many states want to partner with our CMS data interoperability network. It was created by Amy Gleason, who spearheaded so much of the technology transformation in our government. It's going to support the President's pledge to provide transparency that he mentioned as part of the great health care plan. And Congress can ensure these are all available for decades to come if we can get this legislation through. As in the tech innovation forefront, just to give you a couple examples, Texas and Hawaii are making targeted investments in statewide telehealth, so everybody has telehealth. The best doctors for the best knowledge available where you are. We'll meet you where you are. If you're a vet and depressed and you're thinking of taking your life, we'll be there. Just let us know you're in trouble and we'll help. Alaska wants to deploy, and I'm going to hand it to Senator Sullivan in a second, wants to deploy unmanned pharmaceutical distribution kiosks and drones that will deliver medications, because in the North Slope of Alaska, you can't get there this time of year. So these technologies, they exist. Why are we using them in Midtown Manhattan? We should use them in rural Alaska. This administration is committed to collaborating with all 50 states, all 50, red and blue, all 50 states, to carry out bold plans to tackle the challenges that local communities face. We're not pouring funds blindly, however, into a broken system. We're going to carefully, precisely, as the President said, target this investment. With healthcare fund running rampant, and I was in Minnesota this week, Mr. President, it's worse than we've heard, but Minnesota, pardon the pun, is just the tip of the iceberg. California is the varsity team when it comes to fraud, waste, and abuse. We're not going to let that happen. We want transparency for this $50 billion investment. We owe it to Capitol Hill, we owe it to this President, and we want accountability to be a top priority. For that reason, we've created an Office of Rural Health Transformation at CMS for long-term oversight. The office, led by Alina Chekkai. Alina, again, was one of the people who helped create this program in the forefront, will guide. She was in the first administration, Mr. President. She's going to guide states in implementing their rural health transformation plans, coordinate all the federal and state partnerships, making sure there's appropriate oversight. In addition, every single state is going to have a dedicated project officer. We will be there with you. We're going to help you. Please engage us. You've got lots of lives at risk. It's a true state-federal partnership, unbelievable extraordinary milestone for health care. Your zip code will no longer dictate whether you have excellent health care. Your zip code will no longer be your destiny. It's not going to dictate your life expectancy. Mr. President, I cannot thank you enough for the leadership that it took to get this $50 billion investment in rural health care. They don't make a lot of noise. They just want to get the job done. You stood up for them in Congress. God bless you for making this possible. Please do it again. Please do it again for the great health care plan. Let me hand it to Dan Sullivan, who's a spectacular member of the Senate, and obviously Alaska, they're pretty rural.
Thank you, Dr.